Good afternoon, everyone. My name is Angie Lindsay, and I am a team member with the Southeastern Coastal Center for Ag Health and Safety, and also a member of the PI Center team as well. So welcome to session 7 and the last session of the State of the Science meeting today. And thank you for hopping on over to the other Zoom call like this. Thank you. So our roundtable discussion, we're going to finish out today with a great roundtable discussion. And the title of our discussion today is Agricultural Centers Roundtable, Impacts of COVID-19 on Extension Agents. And we have Dr. Galindo, Dr. Ramos, and Dr. Sampson. So Dr. Galindo, Dr. Ramos, Dr. Sampson, I will turn it over to y'all. Thank you very much.
Thank you very much, Dr. Lindsay. Good afternoon, everyone. Now, in response to the COVID-19 pandemic, a group of evaluators from almost all of the agricultural health and safety centers funded by CDC NIOSH came together and formed a cross-center evaluation team. This team aims to generate evidence-based information related to the impacts of COVID-19 to better inform the decision-making processes of the different centers. My co-presenters and I represent 3 of these centers. You can see our logos and names here. However, the survey that we used to collect data for today's presentation was developed and distributed through the collaborative effort of the whole team. Before we move to the next slide, I would like to ask if we can have the first poll. We really want to know a little more about all of you that are here. So if you could respond to, there are a couple of quick questions. Philip, when we are ready, could you share the...
Sure thing. Yep, we're pretty much everyone has submitted their response, so I'll go ahead and end now and share. Okay. I'll give you about 10 more seconds, 5 more seconds.
Nice. Okay, so we are heavy on the side of academia and research. Yeah, we have a government agency represented and another group, and also most of the participants are associated with one of the health and safety center. Okay, this is good because this will help us as we go through the presentation to get an idea on the type of examples and things that we may tap into. So five centers of all the centers that participated in the group, 5 centers distributed the survey among extension professionals in the regions. In this presentation, whenever this type of a slide is used to show a comparison across centers, each center is identified by a particular color. You can see the acronym of each center and its associated color on the top right corner of the figure. This particular graph shows the distribution of responses by role of the respondent in the extension organization. A total of 1,389 usable responses were collected. Overall, you can see that there was a good representation of different roles in the responses. The majority of respondents from most centers were extension agents, which was expected. However, this is not true for PNASH, where the other category groups the larger proportion of respondents. Almost half of the respondents identified agriculture as the focus area of their programs. Youth, as well as family and consumers, were also identified as program focus areas by considerable proportions of respondents. Almost 40% of respondents were using formal guidance documents to learn about COVID-19. It was very important for us to know this, given the key role extension plays in providing evidence-based information to their clientele and communities. More than 90% of respondents indicated that they probably or definitely had the information required to protect themselves from contracting COVID-19. The majority of respondents prefer to receive evidence-based information in the form of fact sheets. Emails and websites were also identified as desired ways to receive this type of information. When we asked them about how much they trust different sources for information about COVID-19 prevention and treatment, the majority of respondents reported very high levels of trust on healthcare service providers, and also high levels of trust on extension administrators and university administrators. These were followed by local elected officials and state elected officials, and federal elected officials and news reporters came next, and as was expected, almost 70% of respondents had no trust at all on social media influencers as sources of information about COVID-19 prevention and treatment. Now, close to 90% of the respondents had not visited or did not know if they had visited the NIOSH Agricultural Health and Safety Center's website for information or resources on COVID-19. This is something that now we have homework to do here. A good sign was that more than 90% of respondents felt to some extent that they were getting the needed support and were prepared to address the professional challenges that they were experiencing during the COVID-19 pandemic. As providers of evidence-based information in their communities and networks, it was not surprising that 80% of respondents, all of these, had shared information about COVID-19. They used multiple communication channels and different forms to do this. And as we can see here, almost half of the respondents had used social media for this purpose. This is also important if we want to provide them with information that they can readily share. Comparing across centers and looking at the best practices most used to fight COVID-19 in the respondents' communities, we can observe a pattern in which social distancing is the most commonly used practice, followed by the use of face masks, and then we have the non-category, where unfortunately we find that up to 24% of respondents communities from one center and 21% respondents communities from another center were not using any of these best practices at the time of data collection. And finally, we have the other category that completes this pattern. However, regardless of that pattern, there are still differences between centers in each one of these categories. Between 20 and 35% of respondents indicated that their communities did not experience shortages in the supply of necessary equipment or supplies. However, between 34 and 47% of respondents from 3 centers reported shortages in the supply of face masks in their communities. Almost 88% of respondents agreed to some extent that there had been cases of COVID-19 in their communities. However, almost 57% of respondents also agreed to some extent that people in their communities do not believe that they were at risk. The majority of respondents, that is greater than 68%, agreed to some extent that their communities' government officials had taken appropriate measures and were providing appropriate information to prevent the spread of COVID-19. A lesser proportion of respondents, about 45%, agreed to some extent that their communities had enough resources to limit this spread. Now, this is a different type of graph comparing responses across centers. Each one of the bars represents a center in this figure. Across all centers, the large majority of respondents, over 90% in average, reported having observed stress or other emotional symptoms in their clientele. PNASH had the largest proportion of respondents that had observed clientele exhibiting these symptoms at a great extent. Almost 23% of respondents from that region reported this. Something very concerning was that more than half of the respondents did not know if their counties had available programs for stress assistance, while 10% reported not having these programs available in their counties. Looking at the stress felt by the respondents themselves, we can see that they are not very different from their clientele. Most respondents reported being stressed to some extent as a result of the difficulties of balancing personal and professional needs, 88% of them. and from the difficulties of balancing working remotely and family needs, 78%. At least sometimes over the 2 weeks prior to completing the survey, 85% of respondents felt nervous, anxious, or on edge, with 17% feeling this way most of the time or always. And at least sometimes during that same period, 64% of respondents were unable to stop or control worrying, with 10% experiencing this most of the time or always. Now, I want to pass this to Dr. Sampson.
Thank you. So I'm going to be continuing to talk about some of the stressors and some of the situations that the extension professionals were dealing with. And as I talk about balancing family needs and work, you might hear in the background at some point a violin playing. I have a high schooler who is doing NTI, instruction from home, and she's doing orchestra class right now. The people who responded to this, the extension professionals, for the most part, did not have children in the household. But of those who did have children in the household, especially those who had children under the age of 5, they reported having a great extent of difficulty balancing working remotely and family needs if they had children that young in the household. Okay. So thinking about the stressors that the respondents deal with, the biggest stressor is childcare. And then also, interestingly, another stressor that quite a few respondents mentioned having extreme or very much or moderate stress was receiving medical care. How stressed do respondents feel about arranging childcare by children in the household? So those with very young children, over 1/3 felt extremely stressed if they had children under 5. And so that families with young children who were extension professionals had a great deal of stress related to finding childcare. When we look at the number of respondents that had children in the household, 60% did not have children in the household of the respondents, but 40% did have children in the household, and that 40% is made up of 26.2 are ages 5 and older, and then under 5, it was 13.8% of the respondents. Of the respondents who have children, how they are cared for while schools are closed during the COVID-19 pandemic. You'll see that 65% said that it was the respondent who is in charge of caring for the children. And then the majority of the other respondents said that it was their spouse that was in charge, or another member of the family also played a role in childcare while schools were closed. Where respondents currently conduct their work. So this is interesting. You'll see that the Great Plains Center, most of the respondents said that they are working mainly from home. SCAHIP, so that's the Southeast Center. This is the center that I represent. We had quite a few who were working from the office. And then you can see that there was variation across the different centers, but quite a few working from home. How COVID-19 has affected their working hours. Again, so this is interesting, again, looking for me at the Southeast Center, that for the most part, the respondents were working regular hours. 81.7% of respondents were working regular hours. And that's actually true across each of the regions, that for the most part, the majority were working regular hours. You do have a few who were working more hours, and for the most part, they were still working. And so you see that very few are laid off or furloughed. And some were working few hours, but for the most part, we had regular hours being worked. How worried were respondents about contracting COVID-19? Well, most were somewhat or just a little bit worried. Interestingly, there you see more worry in the Great Plains and the Pacific Northwest. That there was for especially Pacific Northwest, you have a higher percentage who are extremely worried or very worried. And then also Great Plains, you have more in that extremely and very worried, those categories. Actually, yes, I can see it in the Southeast Center as well, a little bit of the higher end of worry. Respondents' level of agreement with I know the proper steps to take if I think I have been exposed to COVID-19. Most of the respondents agree that they knew or know what steps to take. You'll see that really it's the majority. However, you'll see that there is some disagreement, and 5% strongly disagreed that they know what steps to take if they think that they've been exposed. So how often do the respondents follow different methods to fight COVID-19? Most wash their hands. You'll see that almost 70% of respondents wash their hands with soap and water for at least 20 seconds, and about 60% social distance every time. And so these are the steps that people are really consistently taking across the nation, across different centers. People were much less careful about touching their nose and mouth. So you'll see that we see more of that happening sometimes. And then there is variation, as Dr. Galindo mentioned, there's variation in how much people are using face masks, covering their face in public settings. So the number of respondents who have a healthcare provider to contact if they become ill, most do have a healthcare provider to contact. And this is not the groups that they're working with. These are the actual extension professionals. It's interesting that you have at PNASH, so the Pacific Northwest, you have a little over 7% that would say they do not have a healthcare provider to contact. And same with the Southeast Center, that you have, again, about 7% of respondents said they do not have a provider to contact. How far respondents live from the closest healthcare facility to get regular medical treatment for COVID-19. About 3/4 live less than 15 miles away, but you'll see that some live very far away. So a small percentage live more than 75 miles away, and also between 56 and 75. But it's interesting that 20% live between 16 and 35 miles away. So a decent distance from the nearest healthcare facility. This is a question that we were interested in our center in particular. How many respondents work in a household with someone who has a job in which they may come into contact with a person who may be COVID-19 positive? We see just under half of the people who said yes at the Central States Center, at the Pacific Northwest Center, and the Southeast Center, and just over half at the Great Plains Center and the Southeast Center, which is what the center where I reside. And then again, this is one where my center really stands out, and not necessarily in a good way. The respondents' decision about using a COVID-19 vaccine if it were available. This one is interesting. You see that mostly over half would use a vaccine if it were available. However, not at the Southeast Center. Just under half said, yes, I would use a vaccine if it were available. And again, these are the extension professionals that are answering this. Mostly, well, we also have some maybes, but again, 20% of the respondents from the Southeast Center said that they would not use a vaccine, that they wouldn't take that if it were available. And interestingly, I think Athena is going to talk probably a little bit more about some of these implications, but I live in a state and in an area where our governor is really pushing mask mandates and where the vaccine is really being pushed. In fact, across our state, very few schools are open. We have really a lot of restrictions in this area. And so it's surprising because we're waiting for a vaccine. So it's surprising to me to see that a fifth of respondents said that they would not take a vaccine. So moving on to the discussion, Dr. Ramos, if you'd like to take over.
Sure. Good afternoon, everybody. I'm Athena Ramos, and I represent the Central State Center for Agricultural Safety and Health, which is based in Omaha, Nebraska. We serve a 7-state region consisting of North Dakota, South Dakota, Nebraska, Kansas, Missouri, Iowa, and Minnesota. And I get the pleasure of kind of closing our session today and tying everything together for our group. So we know that Extension is a trusted partner in most of the communities that we serve, especially in the agricultural communities. Oftentimes, Extension is thought of as being information first responders because they have that trust with the communities that they serve. So it's really critical that our Extension professionals are getting quality information because they're really ones that are sharing that with community members. And with that information, making sure that it's relevant, that it's reliable, and it's credible information to try to reduce the community's stress is really important. And we need to really take care of the people who are taking care of us. And oftentimes we think of Extension as being a partner, especially from the Ag Center perspective, we think of Extension as a partner, but very rarely have we thought of Extension also as a client. And, you know, Extension professionals, they've been very busy with the pandemic. They've been trying to disseminate a lot of information, educational materials, even sanitation supplies to many community members. They've also had to transition a lot of their programming to online or virtual platforms, just like many of us have had to do. And they're also having to share community resources like pantries and childcare opportunities with the people that they're serving. So they're also under a lot of stress. And so what we saw in this survey is that Extension professionals are our partner, and that they could be our client too, because they also have some difficulties in managing both the family and the professional concerns. So we have a number of opportunities that follow from the results of this survey. First, I think this is a great opportunity for us as NIOSH-funded ag centers to develop and expand our relationships between us as centers and with Extension professionals, because oftentimes we're serving the same constituents, and we can also serve Extension with much of the materials and the information that we are all producing. Second, I think it's important for us to understand the concerns of these information first responders and to develop relevant resources and programming to serve them. For example, in some of the centers like in Florida, I know that they are in the process of starting to roll out some mental health first aid programming, some stress management modules to try to help alleviate some of the concerns that many of these Extension professionals are feeling. So it's about the data. We're trying to make it useful and trying to do something with it. And this is one of the ways that one of the centers is using the data. I'd also emphasize that there's an opportunity here to also collaborate with the farm and ranch stress assistance networks that are established already throughout the entire country to push out some of this programming associated with mental health and stress. Third, I think this is an opportunity for all of us to not just develop materials, but to cross-promote materials between ag centers and Extension. For example, we heard from the Extension professionals that they were really interested in fact sheets, that they liked websites, and these are things that all of our ag centers do and have. For example, there's been a whole number of fact sheets that have been produced around COVID-19 by various ag centers. These are things that could be shared with Extension. All of the ag centers have websites. We are always populating these websites with the most up-to-date resources that we have. Again, we need to be sharing these with Extension because oftentimes they don't know that our websites exist and they don't know the types of resources that we have. And I think on the flip side, we often don't know what they have. There's also rural assistance hotlines, and that's another opportunity to get those numbers out there and made more public. All of these types of resources, fact sheets, websites, hotlines, these are things that can be promoted on social media. So we heard that a lot of our participants, our respondents in the survey were promoting information on social media. We can feed them this type of information because it really does have best practices and the most up-to-date science type of information that's available. So that's another opportunity. We also know that there's limited trust, we could say, with government officials. And so we can build on the high level of trust that extension professionals have with healthcare professionals, that they have with university affiliated people. So we can use this to our advantage in sharing that type of information. Fourth, I would say that we can use this information to advocate for more health and socially supportive types of policies for extension professionals. I can give you an example here in my state, in the state of Nebraska. At the university, as soon as, well, when the pandemic started back in March, our university gave each employee 160 hours of administrative leave, so that we could be able to take care of ourselves in the case that we got sick and needed to isolate ourselves, or if we needed to quarantine because we were exposed to somebody who had COVID-19, or if we needed to deal with childcare or family care types of issues. This leave was available to us. So this was above and beyond what we would normally get. This was also available to extension professionals. I think policies like this support people, and they're in the best interest of supporting these folks who are working through our extension programs to really be able to bring their best selves to work. And so I think using this type of data to promote these types of policies is also a really good step for us. And finally, I would like to say that I think this type of research study is a great example of how we can foster trust and collaboration between the ag centers all across the United States. I think we've done a really great job of partnering together, and oftentimes partnerships are difficult, they're challenging, and they take time. And so I think some of the infrastructure that was built through this endeavor is something that can be useful moving forward. So with that, I know we are running short on time. Our group would love to take any questions that you may have, and I thank you.
Thank you, Dr. Ramos, appreciate that. And Dr. Galindo and Dr. Sampson as well. So there are a few questions in the chat box, and we do have a couple minutes to answer some of these as well. One of the questions is, it's interesting that the centers that had lower percentages of respondents practicing methods to fight COVID-19 showed higher concern about contracting it. So anyone have a comment for that?
Could you repeat the question, Angie?
Sure, yes, sorry. It's interesting that the centers that had lower percentages of respondents practicing methods to fight COVID-19 showed higher concern about contracting it.
Well, we really don't have data in the survey to answer that, but one of the things is that if I am concerned, I may be concerned, but if I am not in an enabling environment to practice the recommended best practices to fight COVID-19 to prevent, then I am limited probably by my environment. So that is an idea. I don't know if there may be other possibilities of that.
I think we also discussed the difference in politics between the different regions. I know in our region is fairly conservative and has been very pro-business and open everything back up. And our governor has even told communities if they have mask mandates that he would pull public funding. So that's part of the reason I think that we see some of the differences in the types of protective measures that people are taking because of the political rhetoric that's out there. And I think that also has an effect on people's perceived need, because the politics is not always aligned with where people are at. And I think that's a great example from our region.
Well, and now looking at the question, I am looking at the question here in the chat box. Also, yes, probably one thing, I think you are talking about the communities when we ask them about the use of these practices in their communities. So I think that makes sense, because if you see fewer people that are following the recommended practices, probably you feel that you're more likely to get sick because all those people are walking around without face masks and all those different things. So that may be another explanation for this.
Great, thank you. Another question here in the chat box, maybe we'd see as well, was there any information collected on how the extension professionals felt about their employer's response to the COVID-19 situation? This is in terms of employee safety, risk mitigation considerations, and respect to in-person extension events or activities. And also looking at the flexibility to do things like work from home simultaneously, care for children as reported. Dr. Sampson, you reported on some of those results as well. So any information collected regarding their feelings on how they felt about their employer's response?
Well, I think we don't have that level of detail. We did include a question on if they felt that they were getting the required support from their employers. And if I recall correctly, the numbers were like, I think like 70% or more, probably close to 80% reported that they were supported to a certain extent from receiving the required support. And also they felt prepared to deal with the new challenges of the pandemic. But we didn't ask all those other questions.
Thank you. Another question that came in was, did respondents know what to do in case of exposure to COVID-19, specifically because of their trusted source of information?
Dr. Sampson, do you want to take that one?
Well, actually, so in response to the first question, one of the challenges that we faced as this group was working is how many directions this could possibly have gone. The survey ended up being very long, and as we looked at the amount of time people spent, they were very gracious. And first of all, answering, the response rate was really high. And second of all, in sticking with it and until the end. And so some people had, I think, Glenn, Israel can speak to this more, but I think maybe as much as between 30 and 45 minutes of people sticking with the survey and giving feedback. So it was long to start. And so there was a process of trying to pull out just what information was useful for decision making and helpful for the collective centers. But the question of, so hold on, let me see. Oh, so the other part of this is that this is kind of this first pass. We've done a couple of publications now, or there's one in the hopper, and actually one came out today in the Journal of Agro-Medicine. I got the note that it was published today, that some of you in this meeting were on this. We did a commentary for the Journal of Agro-Medicine, again, thinking about the extension agents as like first responders and the need to just attend to some of the stresses that they may be facing. But I think there are a lot of, we have a lot of potential for digging really deeply into these data. And so this is kind of our first pass, and we have a lot of different groups that are going deeper and parsing out data and thinking about how the regions look different, and then within a region, all of the differences. So we haven't specifically looked at that question, but we have that, among a lot of possibilities for next steps. And maybe you all would have another thought on that, Dr. Galindo or Ramos.
Well, no, I think that covers it. We have a figure that they have the information. They felt that they knew what to do in case of exposure, but we haven't correlated it as Dr. Sampson was mentioning. We haven't correlated that with a trusted source of information. So that probably is something to look at, that, because yes, who they are trusting and also how effective that is, that those sources are being in giving them the information that they need.
Wonderful, thank you. And along those same lines of your discussion now, do you plan to do a round 2 of data collection for the second wave that we may face nationally, of COVID-19?
Well, plans are in place already to do something here in Florida. Within at least right now, just in Florida, not across the whole region of the center. The Dean of Extension has requested that we have a follow-up, and also that we include the staff for we overlooked that when we got the mailing list at the beginning. It only included extension faculty. So that counts extension agents in the county faculty, state specialists, and administrators. So now we want to include staff, volunteers, and probably have a reduced version of that. We haven't touched base with other states in our region to see that. And I think that Dr. Ramos and Dr. Sampson and also other colleagues from the other centers that are participating in the cross-center evaluation team will need to decide if it is feasible. There are a lot of surveys out there right now, so I think we can still collect good data, particularly because this is relevant and based on the time that people spent answering this. They liked that we wanted to hear them, and we gave them a survey where they were able to share a lot of things that probably they were not able to share. So I don't know, but yes, there are plans here in Florida, and hopefully we will do something in the other states and centers.
Also, to that point, just kind of the backseat of this, again, you're seeing the collective response, but this was developed and rolled out at different times. And so it does represent some different time points, which again, if we think about digging deeper, we have an opportunity to think not only about the timing of when groups were taking the survey, but also the timing of what was happening in states. You know, what was the trend at the point of people taking the survey? So there are opportunities to even look within this survey at how the timing of the taking of survey intersects with a lot of the other environmental and external factors.
Great, thank you. I actually have a question. Dr. Ramos, I really appreciated your comments regarding the collaborative effort of all the centers that were working on this together. And in thinking about extension as information first responders, I love that term, by the way. Do y'all foresee a collaborative center effort to maybe have some programs? I know you mentioned the mental health program that we're kicking off here in Florida, but do you see some collaborative programs that we can support extension as many of them are first responders, information first responders, and we know that a lot of them are on the front lines and boots on the ground during disasters, natural disasters, technological disasters, as well as biological disasters such as COVID-19. So just wanted to get your thoughts on, can we take this collaborative effort further, basically?
I would say yes. I think definitely there's an opportunity to do so. You know, like I said, I think we've got some really good infrastructure established right now. So I think we can use that as a platform for moving forward with other initiatives regarding programming as well. I know the outreach corps often get together to talk about what's going on outreach-wise. This could be another opportunity to expand, not just from the evaluation groups, but also to engage the outreach corps in thinking about how do we do this. I know Dr. Galindo and I have had some discussions about potentially expanding programming in Spanish because that's part of what my team does in our region, is focused on farm worker outreach and Spanish language outreach. And so oftentimes those types of resources are much more limited. And so we have had some initial discussions around those types of programs. But to answer your question, Dr. Lindsay, yes, of course, I think there's opportunity to expand.
Wonderful, great, thank you. Any other questions? We have a few more minutes. Any other questions? If you want to type in the chat box, or feel free to unmute and ask as well. Okay. Great.
I like that I can see everybody and everything, so it is there's more connection. So feel free to just ask any question, write in the chat box, or just open your microphone and share with us.
Well, I had a question for everybody. I forgot to put my poll question up, but maybe just by a show of hands or a thumbs up, how many have experience or have worked with extension in the past? We've got 1, 2, 3, 4, 5. Ah, there's the poll. It's magic how that happens. I think Philip is behind the scenes, right, Philip, on this?
Yes, yeah, I did launch the poll. So most people I think have responded. I'll give about 5 seconds and then I'll show the results.
Perfect, thank you. So a good number of us have some experience working with extension. That's good. But it still looked like 20% have not interacted. We know about extension, but we haven't formally interacted with that with the group. So there's an opportunity there to learn more about extension and get more involved with what they're doing.
One thing that is interesting about our center is that we were located at the University of Kentucky in the College of Public Health, and we have just moved from that college into the College of Agriculture. And so this is a change to where we were kind of health. We still worked with extension, but we were health within a health college, and now within an ag college. And so we've even just the distribution of the survey as we moved into a new college gave us a new relationship with ag extension agents. And so this has been really timely for our center as we've changed and found ourselves in a new physical location.
Wonderful. Well, thank you very much, Dr. Sampson, Dr. Galindo, and Dr. Ramos. I think this is a great way to wrap up the session, the State of the Science meeting. And we thank you very much for a great roundtable. And I think looking ahead at collaborative efforts and trying to meet the needs across the country is a great way to end on. So Natalie, I'm going to turn it back over to you. Thank you all again.
All right, thank you all. Good afternoon, everyone. My name is Natalie Santamaria, and I'm the Outreach Coordinator for the Southeastern Coastal Center for Agricultural Health and Safety. Please take a moment to fill out the Day 2 survey event feedback. Speaking of surveys, Dr. Galindo, here you go. Here's another one. It is linked in the chat, so go ahead and fill that out. Thank you all for participating in this year's State of the Science meeting. I want to extend gratitude to all of the presenters and moderators who shared their knowledge and time today. Not to mention my outreach core teammates who were behind the scenes making this 2-day event happen. So thank you. Many of the sessions from this year's State of the Science meeting will evolve into in-depth 1-hour webinars later on this year and throughout 2021. So please connect with us on social media and via our Ag Center mailing list to stay up to date on future events. You actually will get the mailing list pop up if you complete the survey. So you don't have to look for it. We enabled it for you. So this concludes our program for today. Thank you all for joining and have a wonderful weekend.